get started on time. First of all, thank you for being here. For those of you who don't know me, I'm Dr. Franca Alterman, and welcome to our workshop tonight, Managing Childhood Ear Infections Naturally. Before I start, I want to tell you that a lot of the things that I'm going to talk about don't just apply to ear infections. Really, they are for general health, and they apply to any other type of illness in childhood or even in adulthood. So I'm going to start by talking a little bit about specifically how the ear works and how, so I can explain to you how it becomes infected. If you look at this chart right here, it consists of three parts: the outer ear, the middle ear, and the inner ear. And the outer ear comes all the way to where the eardrum is, which is called the tympanic membrane. Inside or behind that tympanic membrane, we call the middle ear, and that's where we have the little three bones that help us to hear. And then beyond that is where the inner ear is, and that's where these semicircular canals are that are responsible for our equilibrium. So when we talk about ear infections, most of the time we are referring to something that happens inside of the middle ear. Because of this, they're usually called otitis media. So it's an infection that occurs beyond the eardrum, in the middle part of the ear right here. And what happens is that normally, because this is a mucous membrane, there is mucus being produced in there all the time. But the connection of the middle ear to the throat is a little tube right here that actually goes from the middle ear and drains right into the throat. And it's in that little tube that the mucus from the ear just drops into the throat. No big deal. Now, the problem starts when, for some reason, there is a blockage of this normal. There's a blockage of the normal drainage of the eustachian tube, which is that little pipe that goes from the middle ear into the throat. And so as it becomes blocked, the fluid that normally gets produced right here actually starts to stagnate and back up. So this is the fluid that then, because it's just sitting there, is a really good breeding ground for viruses and bacteria to grow, and that's how the infection starts. So, under normal circumstances, this middle ear is actually open to the outside of the body through the eustachian tube into the throat. And that's what equalizes the pressure of the air inside of the ear and outside of the ear, separated by the eardrum. It's because there's air actually coming from the throat upward through the eustachian tubes. So most commonly, the infection happens in the middle ear. That's why it's called otitis media. It can be acute or it can be chronic. So an acute attack of otitis media means that it's something that came suddenly and it's a one-time thing. It's normally accompanied by fever. The baby or the child may be lethargic. They may have diarrhea. They may feel, if they're too little to tell you, they will just put their hand by their ear, signifying that something is bothering them, because they can't talk, they can't really tell you. Chronic, we call that when it's reoccurring and it keeps happening. So normally an acute attack of ear infection is something that is self-limiting. We don't even have to do anything about it. It'll last from 1 to maybe 10 days at the most, and the body can just deal with it and get better on its own. The problem begins when we start having them in a chronic manner, meaning that the ear gets better, but then in a couple of weeks or a couple of months it comes back, and it just happens like that around and around. So some of the symptoms of ear infection can include a fever, and it's usually a pretty high fever, 104 or more. Ear pulling, so the baby's going to be just doing that to his ear or her ear. They're fussy, they're lethargic, they don't have an appetite, they may have vomiting and diarrhea. Ear infections are the #1 reason for visits to the pediatrician. And ear infections are the #1 reason why children come to our office. That's the #1 complaint. We get a lot of referrals from pediatricians, in fact, for children that have chronic ear infections because of the great results that chiropractic care has with this kind of problem in childhood. So the real question that we need to address is, why is it that some children get ear infections and some children don't? If we all have the same germs circulating around us, why is it that some children catch it and some children don't catch it? And there is only one answer to that question. There is only one reason why a child would get an ear infection and another child wouldn't. And that reason is weakness of the immune system. So normally the body can and does fight any kind of virus or bacteria that may come to attack it. The only time that the body is unable to do that is when this immune system is so low and so depressed that the virus or the bacteria is stronger than the body's immune system. So the real question is not what kind of antibiotic works better, or what kind of external treatment can we put on. Do we put heat? Do we put cold? It's not about what we do from the outside in. It's about what do we do to the body so that the immune system can raise its level of functioning so that it can be strong enough to fight off anything. And I'm sure that you all know people, if it's not your own child, people that have children with ear infections, they have brothers and sisters who don't get them. So the real question is, how do we strengthen the host instead of how do we fight the infection? So we're going to talk about the different things that are done for ear infections traditionally, and then we'll talk about what kinds of things we can do to prevent them naturally and even to deal with them if they're happening right now. Traditional medical treatment uses antibiotic therapy. So their reasoning is the following. If there is bacteria that's attacking the body, let's attack the bacteria and kill it. Well, that sounds really good until the reason for the bacterial growth is still happening. So you can kill all the bacteria that's coming into that accumulation of fluid in the ear, but as long as there is more fluid there, the bacteria is just going to keep coming. So the antibiotic theory is not really something that works very well at attacking the reason or the cause of the problem. It only deals with the effect of a problem. So then they say, okay, well, if we can't get rid of the fluid with the antibiotic, let's just pierce the eardrum and let that fluid come out. So they actually do. They put a little hole in the eardrum, allowing the fluid to come out, to drain out of the ear. And that sounds like a little bit of a better solution. The problem is that the actual cause for the fluid is still there. Something is causing the eustachian tubes to be blocked and to have that buildup of fluid. So really, we're not solving the problem by allowing the fluid to come out through a different hole rather than through the eustachian tube. The next thing they do when the infections become really chronic is they put an actual tube in the ear which keeps that little hole open constantly, because what happens in this scenario is that the body will heal that within sometimes even hours or days. It'll heal the opening of the eardrum. So then what they do is they actually put a little tube right there which keeps that opening constantly open so that the fluid is constantly draining. But again, it's not doing anything for the original cause of the problem, which is there's something going on with the function of the ear. There's something going on blocking the passage of that fluid into the throat area. So if we said the reason for the inability of the body to fight off the infection is a very depleted or depressed immune system, the question that we're going to ask is, how do we make the immune system stronger? How do we get this host to be able to be in a better position to fight off this disease? So I'm going to give you a lot of different factors that cause depletion of the immune system. The first and one of the most important factors is interference to the normal function of the nervous system. All of you who are patients here, and for the benefit of those of you who are not, the nervous system is the system that actually controls the function of the immune system. So if there is any type of interference in the nervous system, it's going to make the immune system suffer so that it will not be able to respond as it needs to. And we'll talk about nervous system interference in a little bit. Overtiredness. Any of you know that if you go for days on end without being able to rest properly, you will be more apt to catch a flu or a cold or a virus. So overtiredness in children is one of the main reasons why their immune system is constantly depressed. Now, overtiredness is something that we do to them many times because we're constantly taking them outside, going to the mall, going to a friend's house, coming here, going there, and not giving them a chance to just be able to take a nap when they're supposed to go to sleep early. So that's something that we have full control over. Dietary factors is also a huge problem in ear infections causing immune system depletion. There are many foods that we give our children which actually cause an increased mucus production. Yeah. So if already we have a situation where there's mucus accumulation, we're on top of that giving them foods that create more mucus, and we'll talk about those in a minute. This is well known. A child who has been breastfed for a year or more, the incidence of ear infections are almost non-existent. So breastfeeding for at least a year of their life is really important in preventing not just ear infections, but across the board, anything throughout the life of a child. It's very important. So for those of you who are pregnant, just remember that. Very, very important. Exposure to secondhand smoke has been known to cause all kinds of issues with allergies, which is the reason why the eustachian tube may become blocked, because the exposure to this smoke actually causes the mucous membranes to get swollen, and that swelling shuts down the eustachian tube. Overexcitement and overstimulation, that goes a little bit along with the overtiredness. Just keeping a child awake and active and stimulated too much, it causes them also to have depletion of their immune system. Now let's talk about factors that enhance our immune system. So, talking about the nervous system function. As you know, the nervous system actually travels inside of the spine. And if the spine is misaligned and subluxated, it will put pressure on the nervous system, causing interference to its function, which in turn is going to cause interference to the immune function. So regular chiropractic checkups and chiropractic care are known for maintaining immunity at a high level. There are research papers that are unbelievably interesting to read, where children of two different categories have been compared. This category are children of chiropractors who have been adjusted since they were born and continue to get adjusted on a regular basis. The one study I'm thinking of, there's 200 children of chiropractors here. Here they compared 200 children of pediatricians, and they were comparing them on a lot of different areas. The incidence of ear infections was one of those areas, the need for antibiotics, the need for other drugs, and it is amazing when you look at this study how the health of these children compared to these children is just from night to day. So we all know from our own children, from our patients' children, but it's really important to make sure that the spine is always checked on these children to make sure that their immune system is always functioning at its highest. Early to bed and naps. That's how we are going to prevent overtiredness. That is one of the most important things to make sure that our immune system is high, is making sure that the body gets plenty of rest. Allowing a fever. And this is something that has been very controversial for many years, but finally, even the Pediatric Association is now saying, you know what, fevers are good. Chiropractors have been saying this for 115 years, telling their patients, if your child has a fever, let it be. That's how your body is actually fighting this infection. What do you do if you want to sterilize a pacifier?
Boil it.
You boil it. Why?
Kills germs.
Right, so high temperatures, viruses, bacteria cannot survive. What does our body do when there's a virus or a bacteria attacking it? It wants to boil it. It raises the temperature. But in our wisdom, which is taught by TV and drug companies, we want to give children aspirin or Tylenol or some other drug in order to lower their fever. And not only, let's not even talk about the side effects of those drugs, what they can do to the child. Let's talk about why it's not wise to lower the fever. Because that's how your body is actually protecting itself. And you are undoing, you are going against what the body knows to do. If you look at what happens with fevers, because the main question that people ask me at this moment is, well, what if it goes too high? What if it stays too long? Isn't that dangerous for the body? The body knows that. And if you check what happens with a chart, the temperature variations with a child that has a fever, this is what you'll see. It'll spike the fever as high as 104, 105, and then it'll drop it. And then a little bit later, it'll spike it and it'll drop it. It won't maintain the temperature up there for long enough to cause itself any harm. The body is a miraculous thing. It's unbelievable. So we have to learn to trust that the body is doing what it knows how to do. Fevers are usually much higher at night, and that is the way that it's supposed to be. They usually will cause your body to create defenses against the heat. For example, the mucous membranes of the eyes are very sensitive. The membranes of the eyes are very sensitive to the heat. What happens when you have a fever? Have you ever seen that? Glassy eyes? It's because your body actually puts extra layers of tears, knowing that these membranes are sensitive, so it doesn't want to ruin them, so it puts more tears to protect. The brain membranes also are very sensitive to heat. The body puts extra layers of mucus in there so that it protects from the heat of the fever. Even a seizure, which people say, well, if the fever goes too high, then the body is going to have a seizure. Yes, the seizure is how the body gives off the heat of the fever. So all the things that we come to look as bad, we need to rethink them and reevaluate them and realize that the body is wise and it knows what it's doing. So allowing a fever is very important to help the body, or really not to help it, just to let it do what it's supposed to be doing. Breastfeeding for at least 1 year, avoiding smoking around the baby, no TV, video games, going out. This is more about just allowing the baby to rest, allowing them to be quiet and not to have so much stimulation. As we saw earlier, one of the things that depletes the immune system is just too much going on around the baby. Then the clean diet parameters that I'm going to talk about next, including probiotics. Probiotics is a great thing to maintain immune system function, and probiotics come in pill form, but they come in a lot of other things. Miso soup is a great probiotic, for example. So let's talk about foods. These are foods that are well known to increase mucus production in the body. So any kind of dairy products, milk, cream, butter, and cheeses. Number one thing that I would take off a child when they come to my office with ear infections or any kind of respiratory sinus ear problems, no dairy. Roasted peanuts, sweets, and sugary snacks, all are known to increase mucus production in the body as well. And then some eating habits that increase mucus production: eating too much, eating a heavy meal late at night, and snacking between meals. Now on the other side, I'm going to...
What if you have kids that are grazers?
Well, if they're not having any problem, I wouldn't say discourage that. But if they're having problems, then we need to start tightening things. These are foods that greatly help immune system and that also reduce mucus production. Garlic, onions. Garlic and onions are some of the greatest antibiotic, antimicrobial, antibacterial agents that exist. Watercress, horseradish, and mustard.
And hot peppers.
Probably hot peppers also, yes. And then eating habits, eating moderately, last meal early at night, and no snacks between meals.
And if you do snacks between meals, is like fruit and vegetables okay?
Yes.
You're just saying like carbs and stuff like
Yeah,
that.
and sugary. Mhm.
She's saying don't give your kids cookies between meals, is what she's saying.
A lot of moms tell me, if I don't give my child dairy products, then how are they going to get the vitamin A, the vitamin B, the vitamin D, the calcium? This is how you can give them those nutrients. There's plenty of things that you can eat that will replace the nutrients that you would lose out by not drinking milk. Okay, so there's a lot of other things that you can do when your child is having an ear infection instead of taking antibiotics. And let me tell you that in my experience, and I've been dealing with this for 25 years, children with ear infections, the parents usually are suffering a lot more than the child is. So when I tell them, let the fever be, or let them just go to sleep without giving them anything, just let it be, you are in a lot more pain than your child is. But there is a lot of pain in the ear probably for the child, and for that you can do some measures at home that will relieve some of the pain but will not be interfering with the process that the body is trying to go through. So homeopathy offers belladonna and chamomile. Those are things that you can use to help the infection go through. It lowers the inflammation and it helps with the pain as well. There's back remedies, one of them called Rescue Remedy. It's a little cream, and if you apply it right here underneath the ear, it will help also with the symptoms of pain. Doing a massage, right, in this part of your arm or your forearm, just like that. A massage that goes downward from the elbow to the back of the hand. That also, it's a energy point that helps a lot with reduction of ear infections and problems in the sinuses, ears, throat. Some things that you can do on the outside, if you put 5 drops of witch hazel in the ear that hurts every 2 to 4 hours, that gives the child a lot of comfort. It's almost like a numbing agent. You can also put warm lavender or any kind of really oil. You can even use olive oil. You can just warm it up in the microwave for 30 seconds and you test it on this inside of your hand to make sure that it's not hot. You just want it warm, and you drop a couple of drops of oil in the ear. It's really, really soothing for them. Putting a warm, wet towel on the ear that hurts also is very soothing for ear infections. Steam baths, that helps to reduce inflammation and to bring the mucus down. So you can, if it's a child that's really, really small, you can go in the bathroom, close the door, turn the shower with hot water, and then you and your baby can just breathe the steam that comes up. If it's an older child, that you can do over the stove kind of steam bath, where you put a pot of water and you let it boil and you just put your face over it with a towel, and that is a really good way to do a steam bath.
If you have all those play tents,
yeah.
then you put the pot in the tent, close the tent, and then take the lid off, and it steams up the whole tent, and then the kid's not quite so close to the water.
Now, as far as some of the newer things that even pediatricians are telling parents now is to do what they call watchful waiting. And that means, let's not do anything. Let's just watch your baby and let's see what happens. And most of the time, these things will resolve themselves. Like I said earlier, within 3 or 4 days, your child will go through it. So even antibiotic therapy is now being put to the side more and more. But for all these years, antibiotic therapy has been the thing that pediatricians will do with ear infections. So what is our ultimate goal here? I put this picture there because it reminds me of a story that I heard. We treat our bodies sometimes like if they were rental cars. We treat our car, when we buy it, much better than a rental car, right? So we treat our bodies like rental cars, and then we wonder why they leave us on the side of the road. And so what we need to do is to start by realizing that our immune system is the thing that we need to pay attention to. And that there are things that affect our immune system in ways that are either going to make it stronger or are going to make it weaker. Those things are the food that we eat, the water that we drink, the air that we breathe, how much rest we get, how much stress we're under. And in this category, we can help our children to be safe from stress by just watching what's going on around us. Like if you're having an argument with your husband or wife, try to keep that somewhere else so that your baby is not exposed to that. If there is other types of stressful situations going on around the baby, they are so sensitive, they're like little sponges, and they absorb everything that's going on around them. So trying to keep them away. You might say, what kind of stress can a baby have? They have the stress that you have. Everything that's going on around them, they can sense. Breastfeeding at least 1 year. And then the most important thing, making sure that the nervous system is not interfered with by having periodic chiropractic checkups and making sure that they're getting adjusted if they need to be, because their nervous system is what controls the immune system function. Any questions about any of this?
We have a double ear infection right now with my 9-month-old, and over the weekend spiked to 104, and you know, lethargic. We're on antibiotics right now. We actually went to her house Saturday night. She saw us, and ears are pussy. But for a breastfeeding mom, would you suggest taking out dairy and all that in your own diet
Definitely,
for them?
definitely. Is this the first or it's a chronic
This is
thing?
first one.
Well, I think we probably would want to check him and just see if there's also something going on in the spine which may be interfering with his immune system.
Okay.
So I'd like to definitely check him.
Okay.
What else? If you guys want to read more about the research studies that have been done with chiropractic hair and ear infections, there is a great website called ICPA for Kids, International Chiropractic Pediatric Association, ICPA, and then the number 4, kids.com. They have every and any study that you want to know about chiropractic care relating to not just ear infections, but everything. I'm going to pass out a couple of things. One of them is a piece of paper that has all of the stuff that I talked about today. It's right here on this form. So you can take one of these and just keep it. Even if you're not having a problem right now, it's good to have at hand for later on. And like I said, this is not just good for ear infections, it's good for immune function in general. The other thing that I have is a list of topics. If you belong to an organization or maybe in your job, if there is lunch and learn programs or anything like that where you need speakers, Dr. Johnson and I do talks on a lot of different subjects, and the subjects are right here. So we love to go around the community to teach people and to educate people about different ways to deal with health issues without resorting to drugs. So there's a form right here that tells you what the topics are, and it's at no charge. So we're happy to come to your job or to your mom's group, church group, anything that would like to have a speaker. So I'll start with this one over here, and you can just take it and pass it around. This one.
You have one already? Yes. Okay.
Yeah, you have one the last time.
Well, I think, and you emailed me, or Ray emailed me the electronic version of that, so I can print it out.
And next Monday, I'm doing the pregnancy lecture. So if you know any pregnant ladies that would like to hear how to relieve common pregnancy complaints naturally, I'm doing that next Monday night.
Well, look, right now, he's been on antibiotics for 2 days, and would you suggest taking him off the antibiotics and trying to go more the holistic route, or?
You know what? I can't tell you to take them off because I'm not the one who put them on, so I can't give you that advice. I just think that one thing that I didn't talk about, the more antibiotics that you give the body, the more you depress the immune system. So it's a vicious cycle that is hard to break.
You should definitely be giving probiotics to counteract the negative effects of those antibiotics.
At 9 months?
Yeah.
Yes.
They make,
3 days
they make an
old.
infant powder. She's been getting it since the day she was born.
Made of sun.
Or even if you
Or
live out there,
biomass,
the beach
or-
biomass,
Yeah.
that's it.
I didn't know that.
Yeah.
Okay.
So at least you'll be replenishing some of the good bacteria that the antibiotics are killing.
Mine's 2 and he's never had an ear infection.
I have 2. One's 4 and one's 2. Never had an ear infection.
Well, my middle son, every 3 months until he was 5, and they ended up taking his tonsils and adenoids out due to the chronic ear problems. And, you know,
Well, that's where I am now also.
are you?
Yeah, my son's 5 now, and he's had the tubes before. He's had antibiotics before, and we went back to the ear, nose, and throat specialist, and he says, well, I wanna do the tubes again, and I wanna take his tonsils out, and I said, well, wait a minute, I really need to think about this, I mean, because he's had the tubes before, and they didn't work.
But that's the thing, that the tubes are not really addressing the underlying cause of the problem. And obviously his immune system must be really, really depressed for having all these things
Do
come
you
up.
have any oregano oil?
So again, like I told her, I would like to check your son and make sure that if there's any interference in his nervous system, we can fix that so that his immune system can be boosted.
I mean, I even know personally, I had my tonsils out, my adenoids taken out, tubes in my ears twice. They kept saying, she'll grow out of it, she'll grow out of it. I was 19 years old, I was still having chronic ear infections, and my mom started seeing a chiropractor and saw a thing that said, you know, can heal ear infections. I went, and I've never had an ear infection since. Never. And I was 19, I mean, I wasn't growing out of it.
Yeah. Yeah.
And, I mean, I went and had it like a month or two adjustment at 19, and I've never had one since.
And you know what happens, what they mean by they grow out of it? The ear infections may stop, but then
They
they
get sinus
have
infections
asthma, they
instead.
have sinus infections, they have, it's one thing or another. It's all just immune deficiency, really.
Start the cycle
Don't you
again.
think even any child should be on Provax, even us as adults should be on Provax,
Yeah.
correct?
Yes.
My pediatrician says, especially in females, because our body produces so much yeast
Yes.
for probiotics. I mean, both my girls take it, and I can see my daughter's in daycare half a day, and she is not gotten sick like the other ones in
Yeah.
her class have.
Yeah.
And I was just preventing from getting sick and giving us headaches.
Do they take the pill form or powder form? Or?
My kids did the powder form up until they got to an age where they had teeth, and they say at 2 give them the tablets because they don't want them to choke. But
If anybody needs to leave, feel free.
The Eros Choice brand is in a non-dairy base too, so I would recommend getting a probiotic that's in a non-dairy base.
Yeah, that's fine.
And it tastes like sour. It tastes like pixie sticks. It doesn't have any sugar in it. It's just an ascorbic acid base, so it's really sour. And so kids are like, "Oh, this tastes good." I mean, my kids, my 5.5 and 3.5-year-old will just lick it off the spoon. They don't care.
Who's your pediatrician?
Mine? Dr. O'Reilly.
I'm not saying change, but there's other pediatricians. I go to
Valerie
You go to
Myers.
Purple Vine and you go to Dr.
pediatric.
Okay, hi.
Because they go with what you're being taught here and what you believe about doing stuff. They do a homeopathic first, and then if they see need be, then they go another alternative. They're on beach and
But they're not accepting new patients right now.
Colorado.
They're taking newborn, well, they're taking newborn babies.
Who is it?
You'll be fine.
Okay.
Dr. Miles.
Because that was what we get to talk about.
They will take newborn babies,
have
and
any
if you
other
have a new baby,
that you
then they'll,
There's a lady here at the beach
then
who
they'll take
is
everybody
not
else.
as holistic, but at least like if you choose not to vaccinate, she will continue to see your child even if you haven't vaccinated. So she's like a little bit middle of the road. McCarthy.
McCarthy. And Dr. Elvier at World Golf Village is all right.